Hello guys, and welcome to this video to learn the dental instrument names and their procedures, okay? For you to know which dental instrument is required to do which procedure. So now, this is just a dental clinical kit, of course in a metallic container to be sterilized, and this will vary from country to country, from institution to institution, the way we make the dental clinical kits, okay? But from top to bottom, we have the mirror, of course, then the syringe, the dental syringe, then the tweezers, the explorer, and finally we have the excavator, okay? So the excavator in Latin languages is called cureta as well, so this can be a little bit tricky, but in English we call excavator. All right, this you're going to use for the clinical examinations, and the dental syringe, there are many types, okay? That's the carpio, and this is the anesthetic cartridge, and the needle. All right, so the needle is on the left, of course, and you need to choose the best type for you, and then long needles will be used for blocks like this one, for example, and then short needles will be used for infiltration anesthesia. If you guys want to know these techniques, then I will add the link of the video teaching both techniques on the top right corner of this screen. They will show at some point, okay? So that's basically a nice direct technique for the inferior alveolar nerve block, for you to know exactly where we want to go with the needle, and of course it's very close to the mandibular foramen, where the inferior alveolar nerve passes. Alright, let's see now a little bit of perio, and then we have the probe, of course, the periodontal probe. You are going to use this in your clinical examinations a lot, and it's very important. So you have the millimeters, you have the measurements, and then you should be careful to use this on your periodontal assessment of the patient. Then we have the periodontal curettes, and they have different shapes, of course, because they are very good for different teeth and regions. That's the ultrasound. On the left we have the sodium bicarbonate. We have the air polishing with sodium bicarbonate. And then the other tip, the tip on the right side of the screen, is basically the tip to remove calculus, the metal tip of the ultrasound, okay? So that's the periodontal ultrasound. For oral surgery, then we would have, of course, for extraction, the forceps and the elevator. This is a video very useful for you guys to learn about these instruments and about how to use these instruments. There is also the luxator, which is a sharp instrument that is used before the elevator, and you guys will learn this properly on those videos, okay? Especially how to use them. So try to watch them when you are a little bit more advanced in the dental course, for you to take advantage to improve your extractions, okay? So going yet with oral surgery, then we have, of course, a series of instruments to open your flap, right? So this is my surgical table before a dental implant. There is even my iPad, and there is a recommended reference for you guys where I'm talking about this. And we have here even the containers for saline solution. We have the implant kit from top to bottom, right? So then we have the motor now, because you need to use the motor. This syringe on the top is for saline solution with pressure, and that's amazing. Then we have the gauzes. You are always going to use some gauzes. And then on the bottom, from left to right, you have the straight and angled scalpel to be used with the blades, and then periosteo elevators, like the mold, for example. Then you have the Lucas curette, then a sharper curette that is there, and then the tweezers, right? On the other side of the screen, you also have periosteo elevators, and the last one is the tip of the mold one. Then you are going to use burrs, even for the dental implants, and this is a piezoelectrical surgical device with the tips to do osteotomies, okay? So they do osteotomies without affecting soft tissues. They are very useful for extractions and even implant and bone graft procedures. So you should be always reading about this to learn about new technologies and new instruments that are coming all the time, okay? Let's go for restorative dentistry a little bit, and even endo. So this is the rubber dam kit. Of course, the rubber dam is not here, it's just the blue, usually blue, right? The rubber dam. But then you have the frame on the top, and then on the left you have the forceps of the clamps, and then the clamps themselves, and then the punch on the right side, right? So you choose the clamp that is compatible with the shape of your tooth, and then you are going to do your rubber dam to isolate the tooth for your procedure, okay? Now, for class 2 restorations, you need to use the matrix and wedge, all right? So this is an example of a matrix from Ultradent, very useful, and we need to know how to use this for class 2 restorations, okay? Class 1, you don't need that, of course. So you guys will learn this on restorative dentistry, and this is the etching procedure, okay? So this is the Ultra Etch from Ultradent, the etching material. So this is phosphoric acid, and we are going to use this before doing the bond, okay? So that's the bond from Ultradent as well, because you need to apply the bond before a composite restoration, okay? So this material comes already with the tip, the universal bond, but again, there are different materials and different ways of doing this. Then you are going to proceed with the composite restoration, so you are going to choose a composite resin material to do your restoration, and then you need a plastic instrument like this one. So this is usually the name. You need an instrument to insert the resin on the cavity, okay? Just like this. I will also add the link of the video showing this procedure on the top right corner of this screen. It will show up at some point. So you can choose different shapes of materials, of plastic instruments, for you to be able to follow the shapes of the cusps and the tooth anatomy for your restorations, okay? Then you can polish your restorations, and then you need to choose a very nice polishing kit. This is one of the examples, the Jiffy from Ultradent for composites, okay? And then your restorations become more shining, more, of course, they will look so much better. You can also use burrs before that to finish if needed and to adjust in occlusion, but then at the end you polish. All right, let's go for pros now. So we have here a tooth preparation in a mannequin, so you can use the mannequin, the dental mannequin, to train. And now, since the margin is subgingival, we are going to use these materials, and I will add this link as well. So those are the cords for retraction, okay? So we are going to we use the retraction cords to be packed using these metallic instruments of the same kit of Ultradent. Now, for temporary cementation, you can use those materials with mixing pads or glass plates and spatula, all right? So that's zinc phosphate, and the other one is a non-eugenol cement. Or you can use this material from Ultradent, the Ultratemp, which doesn't require glass plate and cement spatula, all right? Because it mixes in the same syringe. So we can also add the video showing this procedure. And then for definitive cementation, then we need a little bit more materials. You have the primer, you have the bond, okay? So you have the definitive cement, of course, and there are several materials. And then you have the light curing device, the Valo-X, that you guys are seeing on the right, okay? So I'm explaining from left to right. Okay, this is very important. We have also the video showing this procedure to you guys. And then at the end, when you send to the laboratory and the crown comes, then you can even polish your crown. This is the polishing kit for crowns as well, okay, from Ultradent. Also a very nice polishing kit. Just for the endodontics not to be so sad, so we also have the endodontic materials, the endodontic files, and then you guys have different types of files with different functions and different usefulness, all right? So you are going to use them to treat the root canal of the tooth. The tooth will be most likely the rubber dam, okay, isolated, so that you have good conditions to treat this root canal. There are also rotatory instruments, okay, and a series of other digital instruments used for endodontics. And just for us to finalize, the nice laser, okay, so we have laser, we already have a video about this, showing a lot of clinical procedures that can be performed using the laser, okay? So if you guys like, please hit the like button, send your comments, subscribe to support the channel, and see you guys on the next videos.